Everyone in America has a stake in health care reform, even if they're happy with their insurance at the moment. And the main reason is that costs are exploding and the health care insurance companies walk away from you without any penalty. They come up with a reason. And we are paying, all of us with insurance, for those who have no insurance and wind up in the emergency room. Women have even more at stake. Why? Because they're discriminated against by insurance companies, and that must stop, and it will stop when we pass insurance reform. Now, how are women discriminated against? If they have been victims, Mr. President, of domestic violence, that is considered to be a pre-existing condition, and therefore they're told they can't get insurance, and that happens in 8 states and the District of Columbia. It's a tragedy, and it will change when we pass health insurance reform. If they're pregnant, only 14 states in America require insurance companies to cover maternity care. Imagine in a country that puts family values first, only 14 states. That will change. And everyone is faced with huge increased costs, but women 18 to 55 are charged nearly 40% more than men for similar coverage in my home state, and that happens in most states, and health reform will stop that. Because of discrimination, women are at risk under the current system. More than 52% of women reported delaying needed care or avoiding it completely because of cost, compared to 39% of men. Now, 39% is terrible. 52% is deplorable. People are walking around sick because they can't afford to go to the doctor, and health insurance reform will stop it. There'll be no more gender rating. Women earn less than men. That's why it's an impossible situation. In my home state, over the past 9 years, premiums have risen 4 times as fast as earnings. We spend more than twice as much as any other industrialized nation on health care. You'd think we'd have great outcomes, Mr. President. We're 29 out of 30 industrialized nations in infant mortality. It isn't surprising when so many women are not getting prenatal care. Medicare. More than half of those on Medicare are women. If we do nothing, Medicare goes broke in 2017. So when politicians try to scare our seniors, it's despicable, because it is a status quo that is dangerous. When we fix Medicare, and we will in health reform, women will get free preventive care, mammograms, annual physicals. So in summary, women, children, and men need us to act on health reform. We must make our voices heard, and I thank my colleagues, my women colleagues, for coming to the floor today to wake up this nation.